everyone. My name is Maria Steves. I'm with Sunrise Bay Area, and I want to welcome John Pearson. He is an emergency room nurse at Highland Hospital in Oakland. He is also the president of SEIU Local 1021 and also a member of East Bay, Democratic Socialists of America. Hi, John. Thank you for being here.
Hi.
Can you tell us a bit more about your background as a healthcare professional and as a nurse, and give us an update on probably the things that are what it's like in the front lines of the fight for against COVID-19?
Yeah, I have been a nurse since 2010, and before that, I was a paramedic in New York City. Started out as an ER nurse, also in New York, and then moved here in 2013, end of 2013, and have been working at Highland since the beginning of that year. And what things look like right now at work, it's very inconsistent. It seems like just started to get the beginning of a surge of COVID patients. Testing's not very widespread, so it's very hard for us to tell exactly what's going on. And I've heard some stories from Kaiser nurses like yourself about some of the shortages that you have at Kaiser. We have similar problems at Alameda Health System where I work, and I'd say probably the flavor of it for those of us there on the front lines is everything is it's inconsistent. So to give you some examples of that, management's been saying for a long time we have all the PPE we need, but we're seeing a really dramatic change over the last month in the way that they treat the equipment that we need for all of our patients. It's on lockdown, it's being rationed. It's different from department to department. We've had management giving people instructions to do things like spray their non-reusable mask with cleaning fluids and then reuse it. We've seen management telling workers that they can only have one mask per week. There are some departments that require very specific protective equipment that don't have that equipment at all. I had the experience last week of bringing some donated N95 masks to the operating room, and the boss came around the corner, pointed her finger at the masks and said, "Lock those up." So our experience has been really inconsistent with PPE. We haven't been getting clear communication from our hospital either about number of cases, what the proper procedures are. It's been very confusing, I think, for all of us.
Wow, that is tough. And I actually follow you on Twitter, and I've seen your tweets about the healthcare worker that got fired for wearing garbage bag, and that's just very painful and unacceptable.
Yeah, I think we were all really shocked at how blatant the whole thing was, because our CEO complained in a public meeting that it should be coming up on video actually on the county supervisor's website very soon. He complained, and so did some of the hospital board members, about that nurse's picture wearing the garbage bag, called it political theater, and then a little bit less than a week later, that nurse was fired. It's a double tragedy too, because his wife has cancer and is in chemotherapy, and they're losing their health insurance because he was terminated, just for pointing out a safety problem.
We're trying to protect ourselves and our family, and that's what happens. I'm sorry to hear that. So, okay. So you told me that you were in New York. You started in New York as a paramedic and as an ER nurse there. So you know how it looks like coming into the nursing, and actually prior to this pandemic. So going back in time before the COVID-19, can you briefly tell us about the state of the hospital before the coronavirus hit, and how prepared the system was for this kind of pandemic?
I think the most important thing for the public to know is that none of the problems that you're hearing about now are new, and that a lot of the death that we're seeing now was preventable. It's been interesting to see two of the things that healthcare administrators go crazy for over the last couple decades contributed hugely to this problem of a lack of PPE. And both of those things come from the auto manufacturing industry. So one of them is called lean management, and it's basically this. I imagine that there's probably something like this going on at Kaiser that you might be familiar with. It's basically a way to get workers to come up with ways to find efficiencies and to squeeze more work out of you per hour. And usually what it leads to is getting rid of some of the workers because you find ways to get, one worker to do the work of two, that sort of thing. Like our hospital has a lean office and they have staffers that staff it every week. And they're constantly trying to figure this stuff out. And usually what it ends in is budget cuts, layoffs, and cuts in the amount of equipment and things like that that we use because the hospital says it makes things more efficient. The other concept that comes from auto manufacturing and is very popular in healthcare is just-in-time supply, which means that our supply chains are set up to not have stockpiles and to deliver exactly, what is imagined to be exactly the right amount of supplies at the right time. The problem with that is that it leaves us completely unprepared for a big surge in the number of patients. And that's why our supply chain has totally broken down because we have right now a huge need for all this extra PPE and the supply chain is not ready to provide it. Both of those concepts come from auto manufacturing, and our patients are not cars, they're not objects, they're real people. And this is not the way to run a healthcare, to run a hospital system or to run our whole national healthcare system. And so I think that it's both things, right? It's like, it's an actual lack of supplies because the system's not set up for a predictable natural disaster like this. That's what this is very predictable. It's predictable that we'd have a pandemic. It's also predictable that that pandemic could be respiratory and might require lots of ventilators, respiratory therapists, extra nurses and doctors. We're just not set up for it. And then on top of that, you have the mismanagement, the same mismanagement that led to using just-in-time and lean management.
Well, thank you for that. So going forward, you mentioned you are the president of the chapter on the Log 1021. You organize that, and this represents the workers in Alameda Health System. Can you tell us about the actions that you've been taking in response to this working condition?
Yeah, there's been a really inspiring amount of workers just organizing on their own. Sometimes that happens in the workplace, but we've been seeing it quite a lot. So just to give you some examples of some things my coworkers are doing, in my department in the ER at Highland, a few weeks ago, doctors and nurses and respiratory therapists realized that the hospital was not going to supply us with some necessary protective equipment. One of those pieces of equipment is called a PAPR. It's basically like a kind of a space helmet that covers your head and goes to a HEPA filter and keeps you from breathing in infectious diseases and other airborne poisons. And so we raised a bunch of money. It's actually over $60,000 now. We researched and bought our own. We have 18 of them now that we purchased. They were very hard to find, but we could find them. And now we're having a big fight with the hospital system about whether or not we're allowed to bring them into the workplace and use them. The CEO is playing all kinds of word games and basically doesn't want to cooperate with us. There are lots of other workers organizing around being able to work remotely. They've come up with proposals and all kinds of solutions for ways they can do their work from home so that they can stay safe and keep everybody else safe. Some of those workers have been sticking together to put pressure on their bosses. One group organized basically what is like a sick out for several weeks, and their bosses are kind of in confusion and don't seem to be able to understand how to respond to that in any organized way. Yeah, so we've been seeing lots of activity. We had a press conference a couple weeks ago, and workers were standing 6 feet apart from each other and speaking to the press. We had really great turnout. And 2 hours after that, the CEO announced that they were giving into a couple of our demands around COVID, which was a big win for us.
That's good. That's good. So going forward, I appreciate everything that you have done and the workers at your hospital have done, actually every healthcare workers and everyone out there. So for our audience, what is it that you think they can do to help out in this work? Yeah.
What we need to be doing is calling on our elected officials. And, I think that a lot of these problems, unfortunately, really can't be solved by smaller we really appreciate all the donations that people are bringing. They actually are helping a lot, but they're definitely not a fix to this bigger problem. What we really need is decisive action at like a state and national level. And so what exactly would that mean? That would mean the kind of demands that people have been seeing healthcare workers making. Right, the state needs to step in and requisition some of the PPE that's in the private sector. So there are lots of warehouses, corporations, factories that aren't going right now, that all have lots of exactly the kind of protective equipment that we need. It really is out there. Government can come in and buy it or requisition it or say we're taking it now and we'll pay you back later. There's manufacturing right here in California that can start up, and it's very easy to convert apparently certain kinds of manufacturing to producing things like N95s. That ventilator research needs to kick up and production needs to happen as soon as possible. That sounds like something that actually takes quite a bit longer. There are ways that we could very quickly upstaff the amount of healthcare workers. It's really ridiculous also to hear that there's a huge bottleneck at schooling. Because of the expense of schooling and because there aren't enough schools, we just don't have enough healthcare workers. That's really crazy. We have enough wealth in this country to be able to put people through school. We also have lots of people that want jobs and want to go to school.
And
Yeah.
we know that this is not going to be the last pandemic, that if we don't do anything, I mean, this is not going to be the last, it's going to keep happening.
Yeah.
What policies do you think should be included in a Green New Deal for public health? Like besides the ones that you mentioned, like how can we do it in a way that supports the frontline communities who are most affected by this crisis?
That's a great question. I mean, I think definitely initiatives that would allow for more people to be able to go through training to become healthcare workers. We definitely need more funding for hospitals and clinics and primary care. And I think, this isn't Green New Deal, but it's a related idea, I think, and it's Medicare for All. If we had universal healthcare in this country, it would actually cut down the total cost that we all pay for healthcare. I mean, one of the things that it just really makes me shake my head during this pandemic, especially, is that we're paying twice as much for healthcare in this country than countries that have universal healthcare. And our healthcare system is way worse. It's broken. It's not ready to take care of all the patients in the country. Like, we're seeing that right in front of our faces at work right now. And that's just a huge tragedy, and it's not okay, and it's fixable. It's not just like a problem that fell from the sky. And so I think I'd like to see that sort of stuff happening, right? Like, there should be I think there should be free college for everybody. We definitely need that in this country to make it a stronger country. But definitely for people going into healthcare professions, there should be free training, because we need those people. We don't have enough of them. And hospitals need to be hiring more, staffing up, and we need to open more hospital beds.
I agree. Yeah, with solidarity with every group and all people, all our members, everyone, we can achieve that. Thank you so much, John, for being here, and thank you for being with us.
Yeah, thank you. Stay safe.